All right. Hey,
Okay.
Mina, how you doing this morning?
I'm good. How are you?
Good. It's actually afternoon your time. You're on the East Coast. We're on the West Coast. Again, just really appreciate you taking time out of your busy schedule to chat a little bit. We last spoke in this type of forum. You were 6 months after your surgery, and next week will be 12 months, a year almost, after your operation. Uh, just wanted a quick update, see how you're doing, what's going on.
Absolutely. So, in the last year, I've seen a major improvement in terms of my pain that I've been experiencing from occipital neuralgia. I think I said this before the last time we spoke. This has been such a life-changing surgery for me in so many ways. It's allowed me to do so many things that I didn't necessarily get to do when I was experiencing that pain for so many years before. So, I would say overall, I have at least a 90 to 95% improvement, which is truly incredible.
Yeah, that's great. And so give me some examples of things that you're doing now that you weren't doing a year before or before that.
I have really gotten into trying different exercise classes, dance, things I really couldn't do physically before because I had that limitation. And every time I would really try to exercise or go beyond a certain limit, I couldn't because of the occipital neuralgia pain. So I'm really excited about that most of all.
Yeah, as an Ironman triathlete, I get that. I think a little bit like you. I don't sit on the couch very well. So,
Yes.
one last question. Obviously, this has been a very positive thing for you. Any lingering effects or pains, discomfort? We were talking a little bit about that last time.
Yeah, it's actually improved since then pretty significantly. I've had some underlying health issues that have kind of contributed to that. But since I figured that out, really the only thing that is still improving is the numbness in the back of my head where the surgery incisions are. But it's very, very minimal. And it's actually better than I could have expected. So
And how much of your overall sensation at this point would you say you still have?
I would say 95%. It
Okay.
still feels a little different than it did before. But even 95% is pretty great in my book.
Sounds pretty good. Well, looks like you're very happy. As you know, and as we said all along, we don't need to chat anymore unless anything comes up, but there's no reason to suspect that you're going to backslide anyway. So I just really want to say thank you so much for sharing your story. And obviously, we wish you the best of luck moving forward. Please keep in touch.
Sounds good. Thank you, Dr. Peled.
Ciao. All right. There we go. Press stop.